Facelift, pre- and post-operative instructions. Preoperative instructions. Do not eat or drink anything, including water, unless instructed to do so with medications, for at least 8 hours before your scheduled procedure. Please do not wear makeup, lotion, jewelry, nail polish, or contact lenses the day of your procedure. A responsible adult should accompany you the day of your procedure and be available to pick you up afterwards. Wash your face and hair with Hibiclens soap the night before and the day of your procedure. Absolutely do not take aspirin, aspirin-containing products, or ibuprofen products for at least 10 days before surgery. Please refer to the provided list of medications to be discontinued before your procedure. You may resume use of aspirin, aspirin-containing products, or ibuprofen 6 days after surgery. Please purchase all your suture line care materials before your scheduled day. Take the Synec tablet marked pre-op 1 to 24 hours before surgery. Please abstain from using any tobacco products, including chewing, smoking, and vaping, for at least 1 month prior to surgery. Failure to do so will result in cancellation of your procedure. Post-operative instructions. You will need a responsible adult to care for you for the first 24 hours after surgery. Compression wrap. You will leave after surgery with a compression wrap on. Do not remove this wrap. We will remove it for you at your first post-op visit. Arnicare Arnica Gel. Apply Arnica Gel to bruised areas 4 to 5 times per day until all bruising is gone. Suture line care. Get the following supplies: antibiotic ointment, cotton tip applicators, hydrogen peroxide. Mix equal amounts of peroxide and water, and place in a pill container. Now you have a mixture for the entire period of suture line care. Use the cotton tip applicators and peroxide water mixture to clean dried blood from the incisions. Repeat as necessary to keep the incisions clean. Cover the incisions with antibiotic ointment at all times to keep them moist. They should not dry out. If the wounds dry out, it can lead to an increase in scarring. Resting, sleeping position. Elevate your head with 3 pillows, or preferably a recliner, for at least 7 days. Sleeping with your head flat will cause an increase in swelling. Ice. Use the gel packs or ice frozen peas with the provided cold pack holder, stockinette, for 30 minutes out of every hour, while your caregiver is awake on the day of surgery. Postoperative days 1 to 3, use the gel packs ice frozen peas in the stockinette for 30 minutes at a time, 5 to 6 times per day. When using the gel packs, place the white side of the gel pack towards your skin. The gel packs ice frozen peas will help reduce bruising and swelling. Heat. Begin warm, moist heat on the 5th day after your procedure. Apply a warm, moist washcloth for 20 minutes at a time, 4 to 5 times per day on the bruised areas. Test the temperature of the washcloth against your forearm to be sure it is not too hot. Remember that you are numb. Hot is not better, warm is best. Activity. Please avoid turning your head or bending your neck for the first week. The shoulders, neck, and head should move as a unit when you turn. Avoid bending and lifting over 10 pounds for the first 2 weeks after your procedure. For the first few weeks after your procedure, take extra precautions to protect your face and neck from trauma. Please avoid strenuous physical activity for 2 weeks following your surgical procedure. Cosmetics. Do not use makeup over the incisions for 3 weeks following surgery. Also, do not attempt to camouflage the bruised areas for 2 weeks following surgery. You may gently wash your face and resume your regular skin care regimen on postoperative day 3. Sun exposure. Please do not go out for prolonged periods, more than 30 minutes, in direct sunlight until all the bruising is gone, at least 3 weeks. If you do, you may develop hyperpigmentation in the bruised areas. Begin using sunscreen 3 weeks after surgery. Hair care. You may wash your hair on postoperative day 5. If you do color your hair, please do it 1 week prior to your procedure. Please do not color your hair for at least 6 weeks after your surgery, as this may alter the skin color of the incisions. Diet. When you arrive home, you may start on a clear liquid diet. If you are not nauseated, you may then advance your diet as tolerated. Tobacco usage. Please abstain from using any tobacco products, including chewing, smoking, and vaping, for at least 1 month after surgery. Medications. You will be given multiple prescriptions, including antibiotic, anti-nausea, and analgesic, pain medications. Please fill these prescriptions before your surgery date. It is important to avoid taking aspirin or aspirin-like medication for at least 5 days following your surgical procedure. You have been provided with Synec Arnica capsules. These are in the blue and orange box. Please take the first Synec capsule the night before surgery. Refer to the blister pack inside the box for remaining instructions. Biocorneum Advanced Scar Treatment. Start 3 weeks from the date of your surgery and use it for 3 weeks. Ensure the affected area is clean and dry. Apply a thin, even layer twice daily. Allow to dry. Wait 15 minutes before sun exposure. At times you may experience any or all of the following. Swelling. Swelling is very common and usually reaches its maximum around 48 hours after the procedure. At 72 hours following your procedure, the swelling will start to subside. Facial discoloration. The bruising will become more prominent on the 2nd or 3rd postoperative day. Keeping your head elevated, use of cold packs for the first 4 days, and use of warm packs starting on the 5th day will decrease the amount of bruising that occurs. Another important factor in the occurrence of bruising is the individual's propensity to bruise. Thinning of the hair. Occasionally, the hair may thin around the incision lines. Numbness. You will have numbness of the cheeks and neck regions. This is usually a temporary occurrence. It should subside around 12 weeks after your procedure. Scars. After the sutures are removed, scars will generally develop a red or pinkish coloration. As time passes, the reddish hue should fade, and the scars will become a less noticeable white line. That may take several months to occur. Depression. It is not uncommon to experience a period of mild depression. It is important to remember it is a temporary condition and will subside. Please report any of the following to our office at 208-344-9115. Excessive bleeding. Sudden swelling or discoloration. Discharge from the wound. Any itching, rash, or reaction to any of the medications prescribed. Temperature above 100 degrees Fahrenheit. After hours, you may reach Dr. Haghighi on his cell phone at 614-592-8666 or Dr. Rowan at 208-724-2648. Never hesitate to call our office if you have questions or concerns. Remember, faithful adherence to the preoperative and postoperative instructions will help to minimize swelling, discomfort, and bruising, and will maximize your procedure benefits.